Okay, so we're going to do some adaptations related to being able to work on the arms in prone. The key questions the factors I have to confirm with the client, that they are comfortable with the arm being in all positions. Are they comfortable there?
Yes.
Even comfortable here?
Yes.
And comfortable if I then take them onto the table, flush against the table, and then fully rotate. So supinate at the forearm and
Yes.
externally rotate at the shoulder.
Yes.
So the goal here is that as I'm working, I'm able to get an angle on the whole posterior side of the forearm. Things to consider too, how edgy the side of our table is with the cushion. That can be determined also by the width of the table. But if I can get their arm in prone rotated in such a way and then I anchor, now I can get access to all of the forearm muscles. And with that, I'm going to get a lot of secondary joint movement at the shoulder joint, which in itself is beneficial. Now, with this, there's going to be being able to work on the lateral side of the torso as well, so specific to latissimus dorsi. And as I get closer to the shoulder joint proper, we have the attachment of lats, the long head of the tricep, the two teres muscles, and infraspinatus all overlaying here in such a way where this cross section is a common area for compensation and dysfunction. So if I just my positioning here is mostly to just anchor and keep her arm in a position, gives me a little counter pressure, as well as just stabilizes her body. So then as I work, I have to be conscious of my positioning. Wherever you see my sternum and my nose pointed, that's essentially the direction of my gliding stroke. So if I just change my orientation a little bit, I don't want to be too much on the edge of the scapula. That's the only thing that can be a little hurting in this position. But I can get the lats pretty good. You might have to raise the table up. You can even accomplish this, or get an angle on lats, not this specific orientation, but by getting into a stool or down on a knee, I switch and I use a soft fist. And I'm going actually in the opposite direction when I do this. This is not one I do a ton. It's if I really have assessed that there's something that needs to be adjusted and lengthened here. That pressure okay?
Yeah.
This offers me, as you can see, I can really create a tension force there. So all that being said, I could use a soft fist for some of this. I find that the edge of the knuckles just makes it a bit more pokey and not preferable. So as I work my way up, I'm visualizing. I got to be careful to not be too much on the scapula and to not be causing anything that feels like a strain in the shoulder joint itself. That's my cautious. That's where my cautions are. So this hand is protecting the ball and socket joint and giving me a sense of where it's oriented. The more control I have with that way, if she slips suddenly, I don't inadvertently make compression where I don't want to. Just kind of sawing back and forth, getting myself set. I want to be on the posterior, inferior side of this. And then the muscle energy techniques I can use, once I get a good compression, I confirm that pressure about right.
Yep.
Okay. Now she just straightens her elbow out, and she has to go to full extension in order to activate that attachment site up at the scapula. So she could just do those elbow movements and slowly back down, let your arm go all the way back down. Good. And extend all the way up. And back down nice and easy. That's the simplest one. It's one I've used a lot. It's easy to explain to a client. and they can feel it happen. So one more time, full extension, lock bevel all the way out, and relax, nice and easy, good. And I can get a little secondary, I've decreased my pressure here, I'm just kind of doing a little, it's like I'm doing this. I'm just letting my forearm do the work. I can let that transition all the way into working on the triceps and the posterior deltoid. Now, a nuance to the muscle energy technique side of this is and I usually just show the client by using their own body. I take the arm and I say, okay, I'm going to have you twist at the wrist and the shoulder in one direction. That's pretty impressive. That shows me some hypermobility.
Oh,
and
yeah.
switch and twist and supinate. So it's supinate, externally rotate, pronate, internally rotate. Supinate, externally rotate, pronate, internally rotate. Now that's going to create a nice shear force under my compression. It's going to activate some of those teres muscles. It's going to activate the tricep. It's going to activate lats. Even infraspinatus, which is an external shoulder rotator of the rotator cuff. So you can see by just showing them that simple motion, I'm getting everything to activate, deactivate, the big on-off switch. More importantly than anything, usually here, we need to help reinforce pliability of the fascial layers between muscles. If there's any adhesion or restriction in there, then all those little muscles can't function independently very well. So the key symptom we'll see related to this is limited shoulder abduction, usually past 90 degrees, so reaching up over your head. Okay, go ahead and extend at the elbow, and then do those big rotations, nice and slow. Always tell them to slow down, nice and slow and controlled. Twist one way and the other. Big twist, good. And then slowly let it back down, relax. I kind of just roll around. Maybe I readjust.
And do you do this in your general, or do you just do it when you see limitation?
Usually when I see limitation.
Okay.
And or the client has indicated a symptom. The number one symptom and or assessment that indicates working this way is that limited abduction. Okay, extension and big rotations.
Would you do it if you saw like one of the scapulas was higher too?
That's it, particularly if it's protracted and elevated.
Okay.
And good, relax, nice and easy. And I saw in the midst of that, a key thing that I look for is, did the motion look and feel smoother and easier for the client to do? If the motion suddenly becomes less restricted, not that they necessarily got more range, but if I see them able to transition from pronation to supination more smoothly, from internal rotation to external rotation more smoothly, I know something good has happened. That might have more to do with the friction between muscle layers and stimulating that hyaluronic acid lubrication between layers. What the question was addressing in that assessment is a good position to indicate this, is in assessing and looking at the scapulas, if I get the client set, and this might just be good and relax, if I get, right when I start a session, if I get my hands on either side of the scapula, I'm following the spine of the scapula all the way down to the tip, and then I'm able to get a good read on what's going on from one side to the other. And this side is actually further away from the spine. That's what I'm seeing. So usually the side that's more protracted and the side that's higher, this side over here, let me shift this just a little bit. There we go. This side over here is actually reading what I would call more dysfunction. Now she's rotated at the head. There's other things that I might have to consider, but typically when I'm assessing this, if I exaggerate what I'm seeing in this assessment, It's that this shoulder blade is over here and up. And that would tell me that something on the lateral side of it's tight, and something above it's tight, and something on the front, the anterior side is tight. That's pulling it up and away from the spine. And that'll be related to common symptoms between the shoulder blades and what have you. So, there, of course, I would always want to work in these directions and orientations. A nice thing to do in this position is just to be able to move the shoulder blade around. Good joint movement related to the shoulder blade is one of the best things we can do. Now you have options here. If you're standing on the same side of the table, just on one edge of the scapula, the lateral edge and the medial edge of it, just grabbing the whole thing and rolling around. Now this hand goes all the way, and I tend to feel like I'm cupping the AC joint, if not the whole ball and socket joint. Just kind of rolling the whole shoulder blade and shoulder joint. So scapula and glenohumeral joint. It usually feels pretty good. And just being able to do some simple shearing of the scapula back and forth related to all the structures on the torso and rib cage, and or how it attaches to the shoulder blade, that general joint movement is going to help reinforce that pliability. Now, on the opposing side, you also could do this. Just make sure you don't tickle somebody by hitting them in the armpit. The same principle. I feel like I can get a little bit better pull here. I'm low on the scapula. I'm kind of not up in the armpit too much. But being able to kind of, I assessed that she was too much that way. So if I can just find a way to reinforce that. I personally feel like this feels better because I'm getting this nice gliding stroke with my pull on the upper traps. I'm getting a gliding stroke on the lats. And then as I push and restart, I might use my thumbs or my palms and get a nice glide on the rhomboids and the mid-trap, which that just has a pleasant sensation to it. Everybody likes the whole, working between the shoulder blades, but not too aggressively. So this is a way to create that sensation, but use our bodies more smartly than doing it all with our thumbs. It's a big pull and push. Big pull and push. I even can smoothly transition from that to the low back. And there's going to be a pull, so it's like a big knee, pull on the upper traps, push on the low back. Then kind of reset, pull, push, reset, pull, push.
Would that have an impact on the cervical spine too, like in the trap?
Absolutely. A cool thing to think about related to creating joint movement, passive joint movement at the cervical spine or the lumbar spine. Anytime I change the orientation of the thorax, so if I'm shifting their rib cage, we see the rib cage moving, so we focus on that. But since the ribs are moving, but the neck and the head are staying stable, there is rotation happening at the cervical spine. It's just that here's my head and my cervical spine, and the ribs are moving here. I'm still creating rotation at the lower segments.
Gotcha.
Same thing with the lumbar spine. If I move the torso, the rib cage, or I move the pelvis, this is how I get some innate secondary passive rotation at the lumbar spine. So anytime I'm shifting the client and feeling like I'm kind of moving their ribs or their pelvis back and forth, I'm getting that passive joint movement at the most movable segments of the spine, which we need. And I personally feel like doing a rhythmic passive mobilization there feels better and is potentially much more productive than taking these structures and stretching them, going to end range stretching. So, and it just fits a little bit better in a massage protocol.
Rocking.
So, there's that.